All right, so let's start. So as we were speaking earlier, this islands of breath exercise we're going to perform today is really about working with the nervous system in the body and working with the autonomic nervous system in ways that actually help us relieve pain or feel a difference. So, in pain, we're really looking is for the smallest movement, in somatic work, where especially have a lot of pain, even the smallest shift, the smallest change is extremely important because what really is happening in pain is that, it goes from being a verb of I am in pain to a noun, I am pain. I become it. I actually embody pain. And that's a very difficult thing to actually move away from on our own because it becomes such an experience of self, of who I am. It is a verb like, okay, I can be feeling pain in my muscle, but then if I feel all the time, I become it. My whole life is about I am pain. I suffer with pain. That's how I describe myself. So in this work, what we want to do is even notice the slightest movements or big movements towards feeling better and begin to actually enrich those experiences. So I want to invite you to just arrive. And the way we do in somatics to arrive is to allow our bodies to come into the space. And notice that my intention and my awareness is flagging a little bit. That is, I'm not. I'm actually beginning to orient. Allow yourself to do what I'm doing. Just notice all the colors and textures and shapes and forms of everything that surrounds you. And as you do that, you notice the colors, the textures, the forms of the stuff that's there. It might be a room you've always been in, or you're in a new office, or you're at work, or in your car. But just notice everything, rotating your head, allowing your eyes to command your neck to be a slave to your eyes as they're curious, and imagining yourself, you're almost like a child coming into a space. Imagine that for the first time you come into this room and notice everything. And at the same time, notice the weight of your body coming through your spine, moving into your sacrum and through your pelvis. And just noticing how the weight of the body feels through your pelvis, how it arrives on your seat. If you're laying in bed or you're on the divan or on the floor, just notice how the pelvis arrives, how the weight of it feels. And just notice also how the weight moves away from the pelvis into your calves and shins and into your knees, and how it gradually goes down into the calves, shins, and your ankles. Notice your ankles. Your ankles are these very important joints that have helped you locomote, move about the world ever since you were learning how to walk. Even when you were crawling, they helped you impel yourself. And notice, just move them around and feel the feet. And notice how the feet can move in so many different directions. These ankles that have taken you in so many ways to so many experiences in your life. They took you to school, they took you to your home, they took you to your friends, they took you to all the experience you've had in your life. And notice the feet. And notice how the feet arrive on the floor and feel the floor, maybe through your bare feet or the echoes of that floor through your shoes, your socks, your sandals, whatever you're wearing. And as you feel that floor, notice that that's your ground. Because this building you are in, wherever you are, is on a foundation. Or if somewhere you're sitting on the grass or on the ground itself, notice that ground. The foundation connects to the ground, which in turn connects to the earth, from which its core emanates gravity. Feel gravity. Feel that illusion that we have as humans of gravity through our weight, feeling your weight. And as you feel your weight, as you feel the weight of your body, notice the sounds that surround you. Perhaps beginning through the tenor of my voice is digitized audio you're receiving through your computer, your phone, your iPad, your laptop. But notice also other sounds you might hear. Maybe the sounds of cars going by, other folks where you are, noises outside, birds, animals, electronic sounds around you. Maybe your phone goes off. Notice the different sounds. And also noticing that sound itself is a product of gravity. Because the gravitational force that pulls us towards the earth also compresses the air and allows these compression waves of air molecules hitting against each other to move in ways when sounds produced, arriving in our tympanus, our ear, allowing us to feel the pressure differences that this big brain of ours interprets as sound. hear the sounds. And as you do that, just allow yourself for a moment to arrive. You just begin to notice yourself and notice the messages your body's sending you. And what I mean by that, notice the sensations that might be there. It can be places that are warm, hot, that are cold, that feel really good. Places that feel a little bit constricted, places that feel maybe tremory, vibrating, wet even on the surface of our skin with sweat. Whatever it is, just notice the different experiences. Notice the sensations that are coming through. And just take a moment, either with your eyes closed or your eyes open, to experience the messages your body is sending you in this moment. And really take your time. I'm going to begin a very simple exercise to help you work with pain. Okay. So as we do that, we're going to gaze in this, working with this islands of breath. So now as you breathe in, just find yourself a relaxing place where you're sitting. If you're sitting in this relaxed area, just breathing. And as you notice the breath coming into your body, notice the displacement that happens in your belly, just in your chest. Just concentrate on that. As I breathe in, I might notice a slight movement or the big movement of my chest expanding. And let's just notice at the bottom of the lungs and the diaphragm, and then the belly begins. Notice that the belly moves. Notice how the belly moves if it does, and the rhythm of I breathe in, the belly comes out, and then it comes in a little bit. Just focusing, even on, if you can't feel it, just the slightest movement, if you don't feel your belly moving. Just focus for a moment, breath in, notice the displacement that might happen, then gentle breath out. Yeah. And notice. And the breath in again. And notice the displacement that might happen. And see what you notice there. If you can notice the belly coming out a little bit, and then coming in, and then coming out again, and coming in. So notice that movement. If you can't feel the belly, notice the chest, how it's expanding, in and out. More air comes in, the whole musculature lets go in the chest and allows breath to come in. And now let's see what happens. You begin to bring your awareness to your shoulder girdle. That is your clavicles up here, the muscles on top. Notice when you breathe in, if those move at all. If you notice your shoulders, when you move into breathing, do they expand upwards and move? Just notice if the breath goes there. You might notice it's just stiff and nothing moves. Or maybe you don't even feel what this means, but just notice if the chest is expanding, how the shoulders can actually move up a little bit and sideways. They actually kind of expand. They move like a globe, like imagine a bubble underneath, and it moves the shoulders up and down. Just notice. You notice if they're not really moving as you breathe in and out. If you can notice the slightest movement somewhere, maybe in the trapezius muscle up here, or the muscles in the back of the head, that is around the neck or the side of the neck, or even in front, you notice the clavicles, that is your shoulder bone just moving up a little, the collarbone's moving up. Just notice the slightest movement. Breathing in and breathing out. Just track the movements. And if you feel tension there, just notice it's there. Don't try to do anything about it. If it's tense and doesn't want to move, it's okay. Let it not move. Let it sit there. But notice what else happens where the breath does go. Does it make the belly rise more? Or maybe your chest is rising higher. than you think it should. Just notice the breath in and the breath out. The breath in and the breath out. There you go. So let's bring our awareness a little bit lower. Feel the belly, and notice if the belly, you can even place your hands there, and notice how it's moving. I have both my hands on my belly, and you can put them however comfortably you feel to put them. Notice the in and out. And if this is where you feel pain in this moment, if you do, just be very gentle. And just almost like your hands when they approach the area saying, I got you, I'm here with you. I'm supporting you. Whatever's happening inside you, I'm here. Notice the in and out of the belly if you notice it, even the slightest amount or a lot. But let's see if you go below, bring your awareness to your pelvis, to your hips, and see if the pelvis moves. See if when you breathe in, the pelvis does something. Does it feel like it expands a little bit, or it rotates or moves a little bit sideways? The whole body is connected. When we breathe in and breathe out, the whole body moves. Slightest movements, it expands the body. So you're just noticing the experience. And notice the pelvis. Let's see if it moves a little bit, or you feel something. For those of you that feel your pelvic floor, notice if your pelvic floor is reacting as you breathe in, as you breathe out. There. Breathing in, and notice what happens in the rest of the body. And then, as you notice the pelvis, now bring your awareness even down lower if you want, to your legs. Do those feel like they're expanding and contracting as well? Yes, you might even put a hand on one of your thighs. And notice when you breathe in, that you might feel the slightest expansion there. It's almost like the tissues go like, oof, they blow up a little bit, like you're blowing up a balloon. It's essentially what's happening, when we breathe in. The body actually, it's like a little balloon that blows up and expands everywhere and then contracts, except in some areas. And we'll work with those in a moment. So feel the thighs. Feel the thighs. Notice, as I breathe in, do I feel anything? And if I don't, that's okay. That's okay. Notice where you do move. Notice the parts that are moving, even the slightest. Bring your awareness to those. Bring your awareness to those. Just allowing yourself to allow your awareness to go where you feel it's most needed. But for now, if you feel expansion of thighs, feel that. And then just very gently, bring your awareness down to your feet, to your toes, to your feet themselves. And notice, when I breathe in, do they move a little bit? Do they expand? Do my toes do something, or they constrict, or they move sideways, or they feel like it's blowing up just a little bit, or somehow the floor feels just a little bit different, or in my shoes as I breathe in and breathe out. So feeling that. Just notice now, as you breathe in and out, how the whole body might be moving in and out in this very gentle rhythm. Very gentle rhythm. Take a moment and just feel that for now. This is life energy, blood coming everywhere to keep us alive. And this is really the rhythm of life, the breath itself, how it brings life. And then, when we're not here anymore, one day we will stop breathing, and that will be our last breath. Essentially, every time we go from breathing in and breathing out, and that moment when we breathe out, we're dead. We stop living. That we will stop breathing there. That will be the end in a few seconds. But we breathe again, and we're alive. And then we breathe out again, and we die for a moment. And then the breath comes in. So really, this is what we mean by the breath of life. This is the breath of life. So now bring your awareness, some of you, or maybe all of you, that feel some sort of pain in your body or discomfort in your body, to gently, very gently, begin to bring your awareness there. Or are there parts of your body that are not moving? If you have parts of your body, you have no pain, but there's parts of your body that don't move at all when you breathe in and out, bring your awareness there. Just bring your awareness there. Or if there's pain in your body, just go on the periphery. Please don't go into it immediately, right into the core of it. Go about 6 inches away from it. If you feel pain, say here in your shoulder, go 6 inches away where there is no pain. Do the periphery and breathe into that area. So imagine you take a breath and feel the expansion within 6 inches of that. And just notice. If you have areas that are not moving at all, feel those. And see with each breath, as you bring your awareness to the breathing around that area, see if with each breath you notice the slightest movement or the slightest shift. And what I mean by slightest shift, does it become more subtle? Does it move more? Do my emotions change? Does my attitude shift? Do I begin to have images coming through my brain or memories? Anything, notice this more subtle change, the most subtlest change. And just go very slowly, breathing in and breathing out. Breathing in and breathing out. And breathing in and breathing out. And just notice. And maybe notice that maybe you can come even closer to the pain. It starts feeling better, just maybe a few inches more in, or maybe half an inch. And notice the difference. And notice the places that are not moving, that maybe something's happening there. They're getting maybe more tense, or they're becoming less tense, or they're moving. Notice the slightest shift and focus your attention on that. Just bring your awareness to that, like, oh, it feels less tense, or oh, God, I get this image of this memory, or I get this emotion. Feel it, notice it, and allow your breath to support you, the breath of life. In and out, in and out. There. Just touching into it, just notice those slight movements, those slight experiences that might be different. And take a moment with this. Take a moment. Yeah. So imagine that those parts that are not moving or the pain are these islands of pain, islands of discomfort. And the breath, the life-giving breath, is like water surrounding those islands. And you can even imagine that in this moment. That as you breathe in, the water is coming in, and actually making the island smaller and smaller and smaller with each breath. So this movement that's happening through your breathing, it's almost like your lungs are massaging your stomach, they massage your heart, your whole belly, even massages the spine. The diaphragm comes in and out and massages the whole area and relaxes it, and relaxes the rest of the body. So as those islands, as you're doing this, become smaller and smaller and smaller, the pain gets less and less and less. Less and less and less and less. You just take a moment with that. And as we are here, we will transition to the next way of working with pain, that we don't have to stop this and do something else. We'll continue. So breathing in and out, and breathing in and out. So as you feel in the island, maybe those islands are remaining the same, or they're getting slightly smaller, or they're getting less hot, less uncomfortable. Whatever is happening, just notice. So here we transition into feeling our emotions and using self-supportive contact, that is our self-contact with our hands, to support the emotions. So Notice how you feel about the discomfort. What I mean by that, what emotions are here with it in this moment? How do I feel about my pain? I feel sadness, anxiety, frustration, anger. Even disconnection is just too much for me, or tired of this. And I'm so sad that I can't do what I want to do. Feel the emotion. Just feel the emotion in this moment. Allow and permit yourself to feel that emotion. And just notice, if you're willing, only if you're willing, notice where in the body you feel it. Where physically? Is it in my stomach, my heart, my neck? Is it somewhere, deep inside my gut where I feel these emotions? And bring a gentle touch to it. Bring your hand and place it there. And notice your hand. Notice how the tissues feel below, if it's on bare skin or over your clothing. Notice perhaps the warmth your hand might feel, or maybe the coldness, or whatever it feels. Notice how it arrives and how the hand thinks as it arrives on your flesh. And on the other side, notice how the tissues are reacting underneath, how it feels to have your hand there. And as you feel the hand there, feel the emotion, name it. Actually name the emotion. What is it I'm feeling? And you can even tell yourself, it's okay. It's okay that I feel sad and I feel bad about my pain. And then we can name it in this way. You say to yourself, I bring comfort to myself. And name your emotion. I bring comfort to myself, for example, to my fear, to my anger, to my sadness. And just notice what happens. I bring comfort to myself. I bring comfort to my sadness. And notice your hand there. And this is self-comfort, but also somatic work to begin to work with the emotions in the body. I bring comfort to myself, to my fear, or to my anger, to my sadness. And just notice even the slightest shift in your pain experience. Even the smallest change is extremely important. And just notice if this emotion you're feeling in this moment shifts towards a more positive emotion. See if it affects the pain. We're really beginning to tap into the mind-body process, right? Those emotions I was talking about. Notice that. I bring comfort to myself, to my fear, to my anger, to my sadness, to my loneliness. Yeah. Just take a moment here with that. And just notice the slightest shifts that might be beginning to arrive. And really taking your time, allowing yourself to really, really have an experience of yourself, an authentic experience of where we are now and how really we feel about what ails us. Just notice the slightest shifts that might happen. And when the shifts come, focus on them. Notice them. Really expand and enrich them. Allow them to grow. And see what happens next. Now, I'll give you a few moments to yourselves. I'll be here. Let's see what happens as you do that. There. Just allowing yourselves, in the interest of time, we would love to have this go on longer, but just allowing yourself to gently, very gently, ever so gently, allowing yourself to open your eyes if your eyes are closed. And as you allow yourself to receive the gift of light again, to just allow your eyes to again be curious, like as I am doing, just begin to circulate around and just look around very softly, almost like upon awakening, and moving around and just looking at the space again. looking at your surrounding experience, and just notice the stuff that's there. Oh, how it looks now. As I'm doing now, notice the different colors, the textures, the forms, the shapes of everything that surrounds you. How light, when it incides on objects, it creates colors and the experience of depth and structure in our brains. Just notice what it's like. You just arrive back into this world and notice the rotation of your neck and just feel yourself. Notice the body, how to arise where you are. And be curious. How does the room look now? Is it sharper? Is it blurry? Is it bubbly? Is it dreamy? Is it far away? Is it dreamlike? Pleasant, unpleasant, different? Just notice the quality. Don't judge. Just notice it for now. Remember, it's all a passing state. Everything we experience in this world is a passing state. One thing happens, then the next, then the next. Life is an experience of many, many, many experiences in the body and the world that are stacked next to each other, and they create our life, the narrative of our life. These are two ways somatically you can work with this type of experience. And there's so many. And I share some that you can actually follow on your own. You know, the culmination of all this is, as I named in our slides, is behavior and agency. Your agency, to really tap into what you can do instead of collapsing to the pain. Asking ourselves, is there something I can do to help my pain? Maybe take a walk, take a warm bath, have a glass of wine, do something that makes it just a little bit better, to actually exercise our agency to begin to grow that part of our nervous system as the other one decreases, to actually have a say in what I am and what I do. Pain often overtakes us and we become it, we become pain. When I started, I spoke about the verb and the noun. I am in pain, a verb, versus I am pain. When we become pain, pain dominates and we have no agency. We lost ourselves. We lose our own capacity to choose. The more we can grow our capacity to choose and do something different, the more the body will react. If we are suffering with chronic pain and we have trauma, I highly, highly recommend all of you seek somatic work to actually begin to release some of that the activation of the nervous system that's creating a lot of patterns or worsening pain patterns. Often, a lot of the pain patterns we suffer, some of them I mentioned, are the direct cause of trauma. Fibromyalgia, sciatica, cancers. That's a whole panoply of syndromes we call that are emergent because of trauma. And if we don't work with the trauma, no matter what we do, these patterns will always remain. So I strongly encourage you to look into somatic therapy, to somatic psychotherapy, to help your individual cases move through. So that's my presentation. We only have 6 minutes left, as I see in my, I was hoping to do a little bit of work with somebody in the audience, however, we just don't have time. Are there any questions that anyone has?
We have one question in the Q&A box here. Sergio, Lilith is asking, I know the neuronal sprouting does and can occur with trauma. I'm curious, does this affect how we experience pain as well? i.e. the pain centers of the brain become more receptive to pain because the area is used more often, creating a bit of a snowball effect?
The answer is yes. There's an old saying in neurology, neuroscience, what fires together, wires together. When neurons begin to fire together, they become more solid. There's more neurogenesis, that is more nerves going to that pathway. So imagine it's only these two little endings that connect together to say there's pain over here and it's going to the brain. Well, if this continues to be like this all the time, the brain says, oh, I need more sensitivity here. So it creates more neurons. So imagine, 20 or 30 of these arms together. So it becomes bigger network. That's what I meant by saying that the spinal cord and the whole neural network becomes thicker, bigger, more wired. Yes, it does. And we can reverse that through somatic work.
Anna.
Hello, Anna. How are you?
Hi, Sergio. Thank you so much. That was such a lovely presentation. It's funny how, I've started having more clients come in with pain recently, and so it's like, oh, it always feels such perfect timing. I'm curious. when you're working with someone and they're coming in and it's sort of like acute pain, and then you do start working with the trauma, and maybe specifically when it's sort of something that's rooted from when they're like 2 to 3 years of age, and they don't really have full, of course, memory. They have body memory, maybe, of that. And when some of that feels processed, but you're unsure whether it's all processed, I'm just curious around any advice around that. And also if something feels like it's sort of gone from something that's then sort of acute to something more chronic, or it's possibly just that it's sort of gone a little bit, you know, when the inflammation maybe starts sort of dying down, but there's obviously still inflamed tissue or something left. I'm touching my hand because my client that I'm seeing, one of them at the moment, has got this weird sensation in his thumb. Sorry.
Well, no, don't say sorry. I'm listening, very closely to your question. Thank you, Anna, for that. I mean, there's a lot of depth to that question. First part of your question is, how do you know we know is some of this resolved? Is that those procedural memories, those deep memories in the body, when they're still there, the experience might still be creating a lot of tension in the body. It can create these patterns, right? So how do we know it's gone? When the symptoms are gone, when people report, I'm in flow, I'm connecting with my friends, I'm more sociable, I'm doing what I'm supposed to be doing in my life, then you say like, oh, this person's back in flow. Their experience, their nervous system has come from here to here. But what if my pain persists? What if I have these patterns like you say here? Is that, remember how I was saying how the neural network wires towards pain or discomfort, correct? So maybe the stress of this trauma this person had fuel this experience here in the thumb or somewhere else, and that's gone. But the neural network connecting this to the brain is still there. It hasn't gone away. Okay. So that has to be worked in a more holistic way by maybe going to a naturopath, working with diet, with supplementation, with body work in order to have this neural network actually move away from that. What we can do as therapists, if we're somatic, is to work with the opposite of this experience. Just, for example, notice what's happening here. Notice if it's too much to go there, notice this weird thing here. And at the same time as you're noticing that, now in this moment, notice something else that doesn't feel like that feels good. And let their awareness go, say, to the other hand or their leg, and then go back here and notice that again, and then notice this part again. The neural network will go like, hey, this pathway doesn't work. The body becomes aware of itself and then wire in the opposite way. That's a very common somatic intervention. It's named pendulation. And this is the work of Dr. Peter Levine, of working with pendulation. So that one thing you can try, because there's two things that are happening. There's a habit in the body. For example, my body's in the habit of always having pain in my stomach. Even when that stuff that's fueling it goes away, the emotions, it might remain there because the cycle is there. So this is when you have to go and attack it from many different ways: nutrition, holistic care, exercise, meditation. You need, this energy is very high. You need energy to counter it with different interventions. So it's you, which is probably very fundamental, but also other professionals, other practices to help support this person to really eliminate such a habit in their bodies. Right? Does that make sense?
Totally. And I come with a nursing background and nutritional background as well. So to me, it always makes sense to to bring in all the different modalities.
Yeah. And this we call complex trauma. And when I work with complex trauma, I rely on other professionals to support this person as well. Everything, activities, social activities, faith, if it's there, spirituality, whatever it is, it takes a lot of energy to actually break down a lot of energy. So think about it in sorts of amounts of energy, right? Thank you, Anna. Thank you. Any other questions?
Chat, but for people who do not feel much of a difference with these exercises, does repetition and persistence make a difference? Amina is asking that question.
Yes, Amina, it does. Remember when I was naming, even, when you do this exercise again, notice the slightest, even the most minimal difference. Like, oh, I just felt a little bit of ease in my diaphragm. Notice that and expand it. Just bring all your awareness to that diaphragm. And then it might go away. When you practice again, you might notice like, oh, my knees rotate a little bit better that way. So you're beginning to actually wire a new neural network very, very slowly. Imagine this is like a child learning how to walk. I don't know if you have kids, how kids learn how to walk. They first start crawling on stuff and trying to hold on, and they drop again to the floor on their butts, and they try it again, they fall again, and suddenly they're crawling and they're doing this and doing that. Finally, they start learning how to walk a little bit, and they always fall. This neural network is predisposed to walking. We all are supposed to be walking, yes? And it takes a lot of practice for that child to learn how to walk. So repetition, repetition, repetition in this positive way is very helpful. So a little child, when it falls and hurts themselves, doesn't say like, I give up walking. I don't never want to walk again. This is it's too painful, Mom. I'm just going to go sit over here in my bed. No, they get up again and try to do it more. That's the impulse, the life impulse. And that's what we're working towards, that life impulse, that life energy to what works. Yeah? So I hope that answers your question.
Thank you so much. And there's one more I think that we should try to address. It's from Christine. I have paraplegia due to a complete spinal injury. How to relate to parts I have no sensation?
How to relate to parts that have no sensation? That's a really good question. Thank you for asking that. Remember how we were breathing into this island, discomfort, stuff doesn't move, and we go 6 inches away? It's exactly what we do. Feel the parts of you, whether it be emotional or physical, that you can't feel, and just step away and see if you can touch. For example, if I can't feel this, as an example, physically, if I can't feel my shoulder, go here. Oh, I can feel this. Yeah, I feel that. Go there. And then when you're sitting there, just notice what you feel there. Notice the sensations and see if you can even begin to touch a little bit into this area, whether it be painful or you can't feel it. And just notice, oh, what happens? Again, the slightest shift. Oh, I get anxious or I get really angry. Feel that and support yourself like we did with your hand. Or even support physically that area with your hand. That's even more powerful. Right? So it's really about approaching this very, very, very slow movement forward of trying to work with this experience in that way. So I just want to show one more slide so people know how to connect with me. Oh yeah, just one last thing I want to say. Thank you all for being here. Just understand and appreciate in some ways within yourself. Be patient with yourself as you're working with pain. Be patient with yourself as you're working with the experiences that are difficult for you. Know that a lot of the stuff that's somatic is not a life sentence. This is a temporary discomfort. If you allow yourself the time to work in this way, you'll be surprised with the results. I also briefly wanted to share my work, which is at dynamicsomatictouch.com. We do trainings, training people using Dynamic Somatic Touch for individuals for your own self-work, but also for professionals. If you're a therapist, a healer, a body worker, Dynamic Somatic Touch teaches you how to use your hands with folks, but also self-supportive contact, where you can help your clients and yourself greatly accelerate the process of healing pain, but also trauma and traumatic experiences. We're having a new training starting this coming Sunday. If you're interested, go to my website and you can find information. And individually, for me as a therapist, sergioocampo.com. Thank you so much for being here, all of you. I really appreciate you. And I hope you are well and work towards healing. That's what we're all here to do. Have a wonderful afternoon.